Hello and welcome to today's webinar. My name is Trevor. I'm the Communications Manager for the Canadian Cancer Survivor Network. Thank you everyone for attending today's webinar, which is the latest in our Spring 2025 webinar series. If you're new to our webinars, a little background on our group. CCSN works to connect patients, survivors, and other stakeholder groups with decision makers in the wider community to engage in discussion and to act on evidence-based best practices to alleviate the medical, emotional, financial, and social costs of cancer. To learn more, visit survivornet.ca. This webinar is being recorded and will be available on YouTube, and a link will be provided by the email you registered with, along with a link to the slides provided with this presentation. We'll have a quick Q&A session at the end, but if you would like, please put your questions in the chat function at the GoToWebinar tab. So this year, CCSN has embarked on commissioning another one of our Leger surveys. It was our hope to get a better understanding of what cancer caregiving looks like and what improvements could be made to the system. And so we welcome back Colette Faust from Leger to introduce the findings of our recent caregiver survey. Colette is a research director at Leger and has 12 years of marketing research experience, spending the last 5 years in the healthcare industry. As a member of Leger Healthcare, Colette has worked on both quantitative and qualitative healthcare research among healthcare professionals, patients, and the general population across a variety of topics, including oncology. And so without any further ado, I'd like to hand it over to Colette to present the findings of the CCSN Cancer Caregivers Survey.
Thanks, Trevor. And before we get into it, I did just want to say thank you to CCSN. We have such a great partnership. And thanks for the opportunity to present these findings. So as Trevor mentioned, we were looking to understand the experiences, challenges, and support needs of caregivers for cancer patients in Canada. And the goal was to help CCSN develop better support systems and resources for cancer caregivers. And so just from a high level, looking at kind of how we constructed the survey, first, we talked to caregivers and asked them about the patients that they are providing care for. So the primary reasons that those patients need their help. We asked about the duration and extent of their caregiving responsibilities, the help that they receive from others, including friends, family, and social services. And then for the caregivers themselves, the impact that caregiving has on their physical and mental health. How caregiving impacts their daily routine, lifestyle, and social activities, challenges that they've faced, and strategies that they've used to overcome these challenges. We also asked about support services that caregivers have utilized, and then asked them to rate the effectiveness and the accessibility of these services. And then finally, we finished up with asking about gaps in existing support services and what additional support caregivers need. So to achieve these objectives, we conducted a 20-minute online survey among 1,000 Canadians who currently act as a caregiver to at least one patient with cancer, or who have acted as a caregiver to a patient with cancer within the past 5 years. The survey was made available in both English and French, and all respondents were recruited via our Leo panel. So that's Leger's proprietary consumer panel with nearly 500,000 members. Other screening criteria were that respondents had to be 18 years or older, currently living in Canada. As already stated, they had to be currently caring for at least one patient with cancer or having cared for a patient with cancer within the past 5 years. We really wanted to talk to caregivers who were unpaid for their caregiving services. And then finally, we provided a list of services, and caregivers had to select at least 2 items in order to qualify for the survey. We had good regional representation across Canada, with the largest proportion of respondents coming from Ontario with 39%, followed by Quebec at 23%. And data collection took place from January 30th to March 3rd. So a little more about who we talked to. Again, we have the representation across Canada. We had an even split of male and female caregivers with an average age of 48 years old. 3 in 4 have lived in Canada since birth, and 1 in 3 are current caregivers. We had an even spread of income among the caregivers, and more than half are working full or part-time, while 1/4 are retired. And nearly half of caregivers are legally married, and an additional 1/4 were single and never married. Finally, we had a good mix of locations by population. Half of caregivers came from a town or city type, and then the remaining half were split between a rural area or a metro. And now to get into the actual results. So initially, we asked caregivers some details about the patients that they are caring for. And we found that caregivers provide care for patients with a variety of cancer types, most often breast, lung, prostate, and colorectal cancer, but as you can see, a variety of other cancers as well. We found that cancer stage of the patient also varies, with 3 in 10 patients stage 4 or metastatic. And the majority of patients have received some treatment. Altogether, 94% have received treatment, and that's as far as their caregiver knows. And most frequently, this was chemotherapy, surgery, and radiation. And half of patients were diagnosed between 2 and 5 years ago. Then we asked more about the services that the caregivers provide and others who might be helping to care for the patients with cancer. 4 in 5 caregivers care for a patient who is related to them. Most often, this is a parent, followed by a spouse or a partner. As I mentioned, we provided a list of services, and caregivers had to select at least 2 to qualify. So this is the list of services here. And as you can see, caregivers selected a wide variety of services that they provide. At the top of the list, we're driving the patient to and from appointments and tests, and doing grocery shopping. And we found that females, those age 55 plus, and those who have been caregiving overall for 5 or more years are more likely to provide more of these services compared to their counterparts. So males, those less than 55, and those who have been caregiving for less than 5 years. When we summarize this up to care provided, caregivers say that they mostly provide support with daily living activities and emotional support. And they estimate that they spend about 21 hours in an average week caring for their patient. 7 in 10 patients have others helping them to care for their patient in addition to the caregiver who was completing the survey. And those who help varies and includes other family members, their children, partners, as well as professional caregivers and friends. Caregivers estimate that patients who have others helping to care for them spend an average of 24 hours per week providing care, although 1/3 said they are not sure how many hours others spend caring for them. And then another question that we had that's not shown here was what happens when the caregiver is unavailable, who takes over caregiving for them. And it largely aligned with the list here. So other family members, children, and partner. So then we asked about the caregiving experience itself and any challenges experienced. And the majority of caregivers have experienced challenges. Most often this is emotional stress, but lack of time, physical strain, and financial burdens are also experienced. And we found that women are significantly more likely to mention the emotional stress of caregiving, while those that are working full or part-time mention lack of time. And then along with the closed-ended questions, which we've tabulated throughout, as well as coding open-ended questions and showing things as a proportion, we did ask unaided questions. So I wanted to provide some quotes that kind of just show more of the picture and the lived experience of these caregivers. So many respondents talked about trying to keep up a positive front for their patient and really how hard that is to do when they themselves are also scared and very stressed about the situation. And then many also mention that caregiving on top of working, having children, and other responsibilities just leaves them feeling very stretched very thin. Among those who have experienced challenges as a caregiver, nearly half have taken time for self-care or sought support from family and friends. Although you can see 1/4 have not taken any action. And those who are age 55 plus, retired, or men are significantly more likely to have not taken any actions to overcome any challenges experienced. Despite many caregivers experiencing these challenges, half agree or strongly agree that they wake up with a sense of purpose, and nearly half that they take better care of themselves now. However, many also agree that they get less sleep than before and that their mental health feels worse now. And then another question that we're not showing the full results here showed a list of activities or experiences and asked caregivers how frequently they experience this. And many frequently experience stress. 66% reported experiencing feelings of stress or anxiety at least once a week. We also asked about occupational status change as a result of caregiving. 1/4 of caregivers have reduced their hours working as a result of caregiving. 9% have fully stopped working, and 7% started a new job with more flexibility and fewer hours. So then, after learning about the challenges that they've experienced, we ask about the impact of caregiving on the caregivers, specifically how it's impacted their overall health as one. And 1/4 report that caregiving has had a slight or very positive impact on their overall health, but more than 1/3 say that there's been no difference or a slight or very negative impact. And then we ask a follow-up question for caregivers to provide more details on why they gave the rating that they did. So positive responses are about improving their own self-care, including focusing on preventative health, improved perspective on life, and having a sense of purpose. But negative responses mention just the increased stress and anxiety and the emotional toll of caregiving. And then we also ask about the impact on their mental health. And so in contrast to the impact on their overall health, half of caregivers say caregiving has had a slight or very negative impact on their mental health, specifying the emotional toll of caregiving and the stress and anxiety that they feel. And then again, I just wanted to add some quotes to, again, show more of the details. So with those positive impacts, they're focusing really on preventative health. Some of them say, it's really given me the perspective that I need to go and get screened for cancers regularly. But on the flip side, some say that they've had to cancel or skip appointments because they don't have time. And also on the negative, some say that they feel they're reduced to their role as a caregiver, and that's all they have time for. They're not able to live their own life. They have to be home a lot more. And then on the mental health side, some say it's nice to feel needed and that caregiving has helped them give them a healthier perspective on life. While on the negative side, they talk about the never-ending stress and feeling, really completely alone. Then we move into any support services that caregivers have utilized. Nearly half of caregivers have accessed a caregiver support service, and this is more so among those ages 18 to 34 and those who are working. A separate question also asked about where caregivers learned about these support services that they've accessed, and more than half say they've heard about the service from a family friend and then followed by a health professional. The survey then goes into other caregiver support services utilized. And so respondents were shown the following statement that explained how the caregiver support services that we were about to show them differed from community-based support groups and services. And based on this, half of caregivers surveyed said they have utilized a caregiver support service. The service access varies greatly. You can see they've really taken advantage of a wide variety, with emotional and practical support topping the list. Caregivers then rank the importance of each support service. And emotional support is ranked as the most important service by nearly 1/3, followed by practical support and respite. And then if you think back to the previous slide where we asked about the impact on caregivers' overall health and mental health, we found that this 50% who have utilized a service were more likely to say that caregiving has had a positive impact on their overall or mental health compared to the 50% who have not utilized a service. So it indicates that utilizing a support service helps to negate that negative impact of caregiving. And then among those who have utilized a support service, half learned about the service from a health professional. And then we also asked about any government programs that caregivers have applied for. 1/3 of caregivers have applied for any of the listed government programs, although no one program was utilized by more than 10% of caregivers. Then we asked caregivers to rate the support services in terms of effectiveness and accessibility. Half of caregivers rate their current level of support as neutral, with less than 1/4 feeling well supported and very few feeling very well supported. And half rate the level of support that they receive now as the same as when they first started caregiving. And then again, thinking of that split of the 50% who have utilized services, they do report feeling more well supported compared to those who have not utilized services. More than 2 in 5 rate the current supports for caregivers as average, and the remainder are kind of split, with 1/4 rating them as good or very good, and again, largely good. Very few are rating them as very good, and 1/3 are rating their support as fair or very poor. And women rate current supports lower than men. While 1/3 think that currently available support services are easily accessible, 1 in 5 do report having had issues accessing support. And then finally, towards the end of the survey, we asked 2 open-ended questions. The first asks about considerations that caregivers make when looking for support and caring for their patients. And cost, location, convenience, and hours of operation are most considered. And then finally, we ask about any unmet needs or other supports that caregivers would need in order to make caregiving easier for them. And unaided, there are many other supports that are desired, but this mostly includes financial assistance, in-home care service, emotional and mental health support, and respite care. And again, because these are unaided questions, I've included a few quotes. The other consideration that many mentioned was someone who's going to listen to their patient and respect them. And then for other support desired, a few mentioned training courses. They said as the caregiver at home with no professional support, it's often very scary, and they would feel more confident and comfortable if they had some training courses, as well as a hotline for emotional support, as well as tax deductions for the caregiver. And then finally, we focused a few questions specifically among caregivers of more than 5 years in order to look at their experience over time, before the pandemic, during the pandemic, and now. And prior to COVID, 44% had utilized any caregiver support service. And thinking back to, that's 51% now. So if you look at this, it does appear that more caregivers are utilizing services now compared to prior to COVID. Caregivers say they can now do a variety of actions that they could not during the peak of COVID-19, with attending medical appointments with the patient mentioned most often. And then again, we asked caregivers to compare the level of support they feel they're receiving now compared to before COVID-19. And 2 in 5 say the support level is the same as before the pandemic, while 1/3 say they're not sure. So to summarize, caregivers devote a lot of time and energy to caring for patients, and they really feel the toll both emotionally and in their day-to-day life. However, caregivers look for the best in every situation, referencing the notion in open-ended questions that a positive cancer patient does better than a negative one. Half of caregivers agree that they wake up with a sense of purpose. And for some, caregiving has had a positive impact on their overall health and mental health. Yet only half of caregivers have utilized any caregiving support services. And this is more so younger caregivers and those who are working full or part-time. Only 1/3 of caregivers think that currently available support services are easily accessible, and 1 in 5 have experienced issues trying to access services. So this indicates that there may be some room to improve access to support services. Comparing caregivers who have accessed support services to those who have not shows that the support services really help to make a difference in the caregiving experience. A larger proportion of those who have accessed support services rate the impact of caregiving on their overall health and mental health as positive when compared to those who have not utilized services. They also feel that they are more well supported as a caregiver. So reaching caregivers who have not utilized caregiver support services could really go a long way in helping caregivers feel more supported and ease that emotional toll of caregiving. And finally, improving caregiver support services will help further support the caregivers. Some mentions of additional support desired include financial assistance, better in-home care services, emotional and mental health support, and respite. And that sums it up. So I hope there are some questions.
Thank you very much, Colette. Very informative, and I think that also gives a good voice to people, as you said, that seems a bit underrepresented in the cancer journey because of just how much that they have, that they do, but there's not a lot of stuff for. So if anyone has a question, feel free to put it into the questions tab on the GoToWebinar tab on the corner there. I guess my first question would be one thing that kind of was a bit glaring is that whenever you were looking at the breakdown of cancers that these caregivers were that they were that they were supporting, I was expecting that the list would be very much similar, almost exactly the same as the number of cancers in general, with lung cancer at the top, breast cancer, and then prostate, then colorectal. But I actually was kind of surprised that lung cancer was so low in the representation of the numbers. And I was wondering, I probably understand if you're not able to answer this question, but do you have any idea as to why lung cancer was less represented in this caregiver survey than it has been in just the general cancer numbers?
Specifically for lung cancer, I don't think I have any ideas. The only thing I could think of that differed by cancer type was some of the open ends. Caregivers really talked about the speed and aggression of the specific types of cancer. So, they would say, yes, I was a caregiver over just a few months' time. So I think the aggression of cancer probably plays a role there, but I don't think that's specific to lung cancer.
Absolutely. Once again, anyone who has questions can put it into the GoToWebinar tab. For you yourself, after looking over the results, what surprised you the most?
Honestly, I think how positive some caregivers reported feeling was very positive to me. I mean, we know it was not surprising that the emotional toll of caregiving is so hard, especially for those who are working and who are acting as a primary caregiver to a parent or a partner. So I was really surprised to see those who said, they have a sense of purpose and that caregiving has given them a new perspective on life. I think a that's a brave approach to the caregiving.
Mm-hmm. One question that we have you had any experience or were there any participants with caregivers for people with chronic cancers like an MPN? And this is a question from someone who is an MPN patient, also has a caregiver in her advocacy organization. So yeah.
There was an open-ended option. So while we did provide a list of the top cancer types, respondents could put in any other cancer types. So I would have to go back. I imagine that might be one that was coded into other, but we could look and see if there were any mentions. I don't recall seeing any.
Excellent. Well, if that's all the questions that we have for today, thank you very much, Colette, for your talk. And we will be disseminating the findings here and having our own, making sure that they are public as well, because it's a very important topic for cancer, cancer patients and caregivers. So thank you very much, Colette, for doing the hard work and putting together this survey, and your team. CCSN very much appreciates it, and we definitely will probably work with you again in the future when we think of a topic that we definitely would like to have researched.
That sounds great. Thanks, Trevor. Yeah, we really value this partnership as well.
We do too. Now, this is one in a series of webinars that we are presenting for the spring and now the summer. We do have a couple coming down in the pipeline. We have another one next week. So if you want to stay in the loop about webinars, visit our website or check your email for our e-blast. If you're not seeing them in your email inbox, please check your spam folder because we do use a third-party email service. Make sure you are subscribed to our newsletter to get all the updates and to not miss out what we're doing here at CCSN, including election coverage on our end. All webinars, if you would like to see them from the beginning, can be found at survivornet.ca/webinar or on CCSN's YouTube channel. And with that, I hope that everyone has a fantastic evening, and we will see you on the next one. Stay safe.
Thank you.